Hello, with this presentation, I would like to introduce you to the new way of interpreting photopic negative response protocol results. This presentation was prepared by Rick, and I would like to thank her very much for the help. We run the protocol photopic negative response mainly to check on the functioning of the ganglion cells. And for the comfort of this presentation, I will use the expression glaucoma patients because they are usually having the lower function of ganglion cells. But please do remember that this can also be used for the optic nerve atrophies and other ganglion cells diseases. Running this protocol, we generated three values: response, A wave, B wave, and photopic negative response. And as we all know, we are different, so we have a different curves, and because of that, we have had the reference data that marked 95% of healthy population as green. However, running this test is to check if the ganglion cells are working. So usually we do have the suspected patients with maybe some lower functionality of retina ganglion cells. And when we before look at this, we look at the photopic negative response amplitudes. We also recommended to you to sometimes look at the W ratio, that is a combination of the different values. And during the time when we collected more and more data from the clinical studies and we got the feedback from the users, we realized that if we look now at the healthy versus diseased, there is a group that actually can have a green color from the reference data for healthy subjects, but can be diseased. So to address this overlap in the population, we decided to improve our algorithm and turn the attention of the doctor from the colored reference data into the clinical decision limits. The clinical decision limits are connected to the W ratio or B wave timing. So we realized by analyzing the data that eye is at risk if the results are in the worst 11 percentile for W ratio or B wave timing. What is very important for you to remember that this is or, not and. So either or will indicate the possible reduction of the function of the ganglion cells. And here we go, the numbers to keep in mind. W ratio equal or less than 11%, B wave time equal or more than 89%. When you look at this report, you realize that both of them are marked green. So all values, including our popular photopic negative response amplitudes, is also green. So that's a significant change and significant improvement in detecting the eyes at risk. With this algorithm, we reach the specificity of 79%, and sensitivity depends on the stage of the glaucoma from 47 up to 82%. So sample results from the previous versions, we had the colors, so this is normal. Here, it's the open angle, severe open angle patient. You can see here that the time is according to what I told you, equal or more than 89%. However, look at the W ratio. W ratio is 25, which is like not at risk. So always please keep in mind that we look at either or. Here is the other example, moderate open angle glaucoma patient, W ratio 1%, equal or less than 11, but the time within limits. The new report, as I mentioned, will have no colors. So healthy subjects, here we have the one example where we have a 92%, which is equal or more than 89%. W ratio within the limits, again, either or. And another example when the W ratio is only 7%, but the time is within limits. What happens to the users that refuse to update the firmware? That can be a different reasons. We hope they will update it, and we really strongly recommend that you really convince them. In case they have a firmware 2.11 or less, the sensitivity and specificity will be similar to the new algorithm. But if they have a firmware 2.12, the sensitivity is definitely lower. So please keep it in mind that it will be not so good to use that algorithm. And we also know that some of you will already ask us, can we get the colors back? So all devices delivered by default will have the photopic negative response test results without the color coding. And yes, you can change it, but please remember still to keep it these clinical decision limits in mind. You go to start screen settings, you go to reporting, color coding, and you have 3 options. Default, as I mentioned, all reports with color excluding photopic negative response. Yes. All reports with colors including photopic negative response. No. No colors on any reports. To summarize, eye is at risk if results in the worst 11 percentile for W ratio or B wave timing. If you have any questions connected to this one, please do not hesitate to contact especially Ulrike or me to answer your questions. Shortly, you will get the email from us with the link to the new firmware. Please convince your users to update it. Thank you for your attention. Goodbye.